Archita.
What mental health needs are more sunlight, more candor, and more unashamed conversation. Mental health first aid is the initial support provided to an individual experiencing a mental health crisis or problem. Just as physical first aid is crucial in treating as injury or illness, mental health first aid is vital in providing earlier intervention and support to individuals experiencing mental health issues. Good morning, everyone. My name is Archita Yadav. I will be your anchor for this session on mental health first aid, organized by the Institution Innovation Council in collaboration with the EHSAS, the Mental Health Awareness Society, and Scientia, the Department of Psychology of Shahid Rajguru College of Applied Sciences for Women. Miss Anjali Mahalke, the speaker of the session, is a counseling psychologist. She has worked with a diverse global clientele who face a range of challenging life circumstances such as anxiety, depression, trauma, abuse, relationship troubles, and navigating complex familial and work dynamic. Before becoming a full-time psychologist, she had a privilege of working with the esteemed National Commission for Protection of Child Rights, Government of India. We are honored to have you with us, ma'am. I would request the audience to keep their mic off while the speaker is speaking. Floor will be open for question later. I would now request Anjali ma'am to take over and enlighten us with her knowledge.
Thank you so much, Archita. I'll screen share my presentation, then I'll start. Yes. So can you see now?
Yes, ma'am.
Yeah. So okay. Yeah. So we'll be speaking. I'll be speaking about mental health first aid, and I think the introduction covers everything, so I don't need to mention what goes there. But in the presentation, first I'll talk about what actually is mental health before jumping into why we need it, why we need the first aid, and why we need what kind of issues do we need to handle with first aid kit that I will be talking about. So, so what is mental health? I mean, to be honest, I like more of an interacting session and not used to online workshops. I like doing it in person. So if you want to, if somebody wants to open the mic and say something in between, that's okay with me. So yeah, so what is mental health? So you can see it in this picture, this elephant in the room that we always have, and we hardly want to touch it full. And there is this funny meme which says sometimes even if I stand
Sorry
in the middle of the room.
hello.
Yeah. Can you hear me? Hello.
I'm sorry to interrupt you, but we cannot see the picture. I guess the screen is.
Can you see now?
No, ma'am.
Priyanka, it is visible for me.
Okay, so there might be some network issue over here. Please continue.
Is it visible for everyone else?
Yes, ma'am, it is visible.
Yeah. So I was talking about the elephant in the room. So you can see, you can just imagine us talking on this roundtable conference, and then there is this elephant we are trying to address today. So the elephant says, to the therapist on the left side that even if I stand in the middle of the room, no one acknowledges me. So what exactly is mental health? It's a huge topic. We always keep talking about it. Mental health, this, that, but what exactly constitutes of mental health? So, according to World Health Organization, I think they have given the best definition of mental health, which says it is a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn well and work well, and contribute to their community. So, for most people, mental health is just overcoming stress, anxiety, and depression, and that's about it, because we don't have a lot of vocabulary around it. So that's what we think is mental health. But mental health is a lot. It's a realization of our human potential. And I have also underlined cope, which means, people are coping differently. They're coping in a negative way and positive way also. So this word rightly I have added, rightly cope with the stresses of life. We'll talk about coping on the next slide. But to ensure a good mental state, we need to ensure, our physical well-being is okay. We are doing, we've got our necessities covered. We've got shelter. We've got enough money to sustain ourselves or our family. You're students, so your family is sustaining you right now. But if finances are in place, your health and your food is in place, so that's physical. And social well-being, you have loving relationships. Sometimes we don't have loving relationships in friends, so we have a good family. But sometimes we don't have family, so we have friends. But ensure that you have a good, social community of your own, which you have developed. And there is a saying which is very fascinating to me, and which says that you are an average of 5 people you interact throughout your life. Most interact. So make sure that who are those, just make sure that these 5 people are uplifting and caring and loving and always, putting you, basically hyping you in Gen Z language, but also telling you the truth when it needs to be in a polite and empathetic way. And then mental well-being. So mental well-being is ability to reason, ability to make rational and good decisions, ability to cope. We'll talk about cope in the next topic, next slide. But ability to cope better. Like, you can see this girl is having fun.
Sorry to interrupt you, ma'am. Sorry to interrupt you again in between. Actually, the slides are not moving, ma'am. It's stuck on the very first slide. We are receiving messages from the students.
Oh, okay. I'll just reshare again.
Okay, no problem.
My Wi-Fi is good. Let me just reshare again. Sorry about that. There were enough technical glitches before I joined as well.
No problem.
If I do this entire screen, maybe I'll see. So let me know. I'll move the slides and let me know. So this is the first slide, okay? Can you see the first slide?
Yes, ma'am.
Can you see the second one now?
Yes, ma'am. Visible.
Third one?
Yes, ma'am.
Can everyone else see?
Yes, now
Okay.
it's visible.
Okay, great. So I was on the third slide. I'm sorry. The second slide was this, for those who missed it. And now I'm on the third slide. Yeah. So yes, so mental health, I spoke about, how different aspects of life covers the whole mental health dynamic that we talk about, rather than just depression, anxiety, and the handy terms we have got. So, and spiritual well-being. So this is new. We are the land of spirituality, but we hardly believe, because we thought modernism meant just being away from your own self. But I have taken this from American website, and I think that enough is a good enough reason to consider spiritual well-being as a part of our overall well-being. Spirituality doesn't mean you have to follow religiously somebody and be ritualistic. It means you can just take out 5 minutes to breathing and always probably think about issues larger than ourselves and contribute to other human beings. I think that's spirituality for me, and you can find out your own ways to be spiritual. And emotional well-being. So emotional well-being is ability to express your emotions well, and to be taken, you be taken in your vulnerable side, and people understanding you, and that whole situation makes you good enough to be on the emotional state. So if you have friends with whom you can share things, you can go to your family is supportive, it means your emotional well-being is in place. So yes, so we were, now you can see the fourth slide, right?
Yes, ma'am.
Okay, so healthy and unhealthy coping mechanism. So you can see there are two elephants on the left and two elephants on the right. So what are the two elephants doing? Basically on the right is destroying and eating garbage. Unfortunately, that garbage was created by humans, but they're eating that. And on the left, they are sleeping and playing in the water. Uh, so so there are things happen in our lives, and there are, life is very dynamic and it's always fluctuating. So we do come across as humans a lot of stressors. It may be in your age, stress of exam and unpredictability of your future, and probably fights with your friends or breakups. There are two kind of people. One will go to probably alcohol or numbing their emotions, smoking, or maybe scrolling down the phone is one of the addiction, very big addiction these days. So that means they're coping. Everyone is actually coping with their stressors, but in what way? So that's the unhealthy coping mechanism. But the other part, the other side of the people are who are talking to their friends. Okay, this happened now. What do we do about it? They're taking the time off, thinking about giving themselves a break, probably sleeping, probably going out to play, or do anything that is on the positive side of addressing how to address the issue, rather than actually going into denial and spiraling by choosing the path of different forms of addiction, which can be alcohol. Weed these days is very common in students, and endlessly scrolling on Instagram, which is basically trying to get rid of that anxiety, because anxiety also has the nature of coming back and back, spiraling. So it's designed, right? Social media is designed to basically encourage unhealthy coping mechanism and keep you stuck on the loop like a hamster on the wheel. We have the very famous psychology experiment. Okay, so coming back to what WHO said, mental health is a state of mental well-being that enables people to rightly cope with the stresses of life, because there will be stresses of life. It will never be the case that there won't be. Realize their ability, learn well, and work well, and contribute to their community. Okay, now the important aspect of today's talk is mental health first aid and who needs it. So, there are different kind of mental health issues people go on, and they go on sometimes for their whole life, from probably a year or two. We are not talking about those issues today. We're talking about first aid. So first aid is usually given in the situation of an emergency. When we talk about physical first aid, if somebody got, let's say diarrhea, or they fell, they met with an accident, they got hurt, they got injury, they will be put in band-aid, they burnt. So, in those kind of situations, we generally talk about first aid. Now, in mental health, there are more or less 4 or 5 issues I would suggest that requires first aid. One is panic attacks, second is anxiety attack, third is suicidal episode or suicidal attempt, and fourth is post-immediate abuse, which is, somebody faced disaster, earthquakes, which is not the case where we live, but it's case in a lot of parts of the world. Often disasters are happening. And often disaster, I mean also, places which are war prone, and accident, sexual and physical abuse, somebody, your friend or your family or anyone. I hope it never happened, but if it happens, sexual or physical abuse is one of the key areas we need to understand. How can we provide mental health first aid to those people? And any other moments of great psychological distress, which you can think, if I would be able to help this person with my first aid skills, then it will be great. Because there remains always an undefined area we always need to address. So panic attacks people use very loosely these days. Also anxiety. So it will be great to understand that panic attacks are intense. They're sudden episodes, and there is fear and discomfort. So I've just used the key terms. Very intense. It happens all of a sudden. There is almost there is a triggering point, but sometimes without a trigger also. And there is this huge episode of fear, and the person is feeling discomfort in both physical and emotional way. So the key symptoms are rapid heartbeat, sweating, trembling, and shaking, and shortness of breath, chest pain. There could be chest pain, but yeah, it's a bit of a gray area. I'll talk about it later. Nausea and stomach distress, dizziness or lightheadedness, feeling of impending doom. What does it mean? Feeling of impending doom means something bad is going to happen right now. Like this person feels almost like a phobia that something bad is really going to happen. And hot flashes or chills, numbness or tingling. So this constitute of panic attack. Now we move to. I was coming to chest pain. So chest pain is a bit of a gray area because it could be these are symptoms of also cardiac arrest. How do we figure out the person is actually having a panic attack or a cardiac arrest? I think emotions. So if a person is having a cardiac arrest, I am not a cardiologist, but I would suggest if somebody is having chest pain, you should probably refer them to a doctor, take them to the hospital, whatever. But cardiac arrest people generally will not have sudden episodes of fear and discomfort, and the thought will not be as equal to as person who's facing panic attack, which is cardiac arrest person will not say that something bad is going to happen, and they will not be having intense fear, intense strong emotions. They will be having emotions of discomfort and all those, probably not on the higher negative emotion side. Now we are coming to anxiety attacks. There is not much difference between panic attacks and anxiety attacks, except for the fact that panic attacks happen very quickly, suddenly, and anxiety attacks are gradual onset and longer duration of symptoms, which means I'm stressing about, let's say, breakup, and this person did that to me, and I'm stressing all the time, anxious, I'm losing sleep, and all of a sudden, because my body has lost all the immunity because of the stress, and I've not eaten properly, or probably not gone out, seeing the sun, doing all the negative coping mechanisms about my body and my mind, and that gradually turns into anxiety attack, because we already have that anxiety. We're fueling that anxiety. So that gradual onset, and it is generally a bit more longer than panic attacks. So there is excessive worry and fear, there is restlessness, there is muscle tension. And muscle tension is quite symptom of anxiety attacks, fatigue or weakness. So panic person probably will not have fatigue. They will have hyperactivity more than fatigue is lethargy in a way, prolonged lethargy. Difficulty concentrating, sleep disturbances, gastrointestinal symptoms, which means diarrhea or constipation or any of those things which is related to your kidney and liver functioning, sweating or hot flashes, and your heart may race and pound, and you'll feel like you can't breathe. But this is similar to panic attack also. And again, the feeling of impending doom, which is both, like, it's not going to happen, things going to work out, something is bad is going to happen. So that thought process is always there. Now we will be talking about suicidal episode attempt, and it requires immediate attention, no matter what. You cannot convince yourself or the other person to delay, help. not delay the attempt but delay help. So we need to give immediate attempt to anyone who is feeling suicidal distress. But symptoms do vary from person to person. Some people might feel symptoms which are not even there in the list actually. So, and some people might feel that just one or two out of this list. So suicidal attempt also is not very sudden. It's actually never sudden. It's never ever sudden. It's always a thought in the mind which has remained for a very, very long time. 6 months, year, 2 years, 3 years, sometimes 10 years. So, talking about wanting to kill themselves, what will happen if they die, expressing feeling of hopelessness and being the burden of on others, withdrawing from social activities, losing interest in hobbies and other things once they enjoyed, engaging in reckless and self-destructive behaviors such as substance abuse and dangerous driving, something that can harm them basically. It covers a lot of other forms of activities. And harm in that self-harm in this situation, when person is experiencing suicidal ideation or major depression, self-harm actually gives a lot of pleasure in a way. I don't know why, but it does give a lot of pleasure to people in that situation. Giving away possessions and making other preparations as if they're saying goodbye. Sudden changes in mood, and such as becoming very calm after a period of extreme distress. They just don't want to interact. There is sudden changes in mood. There is sometimes they're slightly happy, but most times sudden changes will mean they've gone into that calm, distant, detached state. Talking about feeling trapped and having no reason to live. So you might have, we've all known these people we've been those people also. And at some point, I think every human goes through this phase. It can be lesser intensity for most people, but for some people it's very high intensity suicidal ideation, which means when they feel like there is no meaning left in living, and then they start planning. But to provide first aid, we need to talk to these people who are actually strategizing. How do we do it? Like dissociating, and there's sudden changes. Like all of a sudden, okay, they have been having, let's say, depressive symptoms for a long time, or probably going to a therapist because of depression for a long time. But all of a sudden, there is a shift in the whole behavior, and probably these behaviors have increased. So in that moment, we need to provide them psychological or mental health first aid. So there are other things covered in disaster and accident, in war, which can have profound impact on individuals' mental health and well-being. One is shock and belief. Disaster happens, we know in Syria, in Africa, a lot of Afghanistan. Somebody is having a house and all of a sudden the bomb drops and they lose their neighbors. Sometimes they don't lose themselves, but they lose the neighbors. So there is shock and belief. There is fear and anxiety, and probably it's gonna happen with us also. Fear and anxiety, and in terms of disaster, in terms of sexual abuse also. There is guilt and shame. Guilt and shame is usually happening to people who have gone through sexual abuse. They think that it's because of them, it's because who they are, how they could not handle the situation when they were in that situation. So there is a lot of guilt and shame that also leads to sometimes suicidal ideation eventually. Anger and irritability. There is huge rage. It is also, if you see, I don't know, I think there are a lot of psychology students. If you see, there are few grieving cycle procedures also written, anger, but obviously not acceptance and denial. But yeah, there is a lot of anger. It generally comes after a point. There are physical symptoms, there are headache, stomachache, increased heart rate. So physical symptoms are also psychosomatic for most part in these people, which means psychosomatic means there is no actual problem in the body. it just feels it. They have manifested the pain so much that it feels real, and it's because of the trauma. It's because they've gone into the survival state. There is flashback, nightmares. One of the PTSD symptoms, there is traumatic event happen, and people relive that memory all the time. Some people, there is this lot of studies done on American war veterans who've gone to Vietnam. They actually did a lot of mess there, but eventually they ended up suffering from all these flashbacks and nightmares of killing children or things like that. Flashbacks and nightmare also happen with people who have gone under some sort of sexual discomfort, harassment, assault, abuse, any forms of sexual abuse. Then there is avoidance. If it's too overwhelming for people, they will probably go into that zoning out survival state where they just don't want to talk about it because it's too much. They appear okay, but they're not okay. They've gone into avoidance and denial. Okay, so next, how to handle mental health crisis. Well, you can see empathy, nurture, wisdom. Let's make it a rule that we all have to be empathetic, human beings. And empathy is different from sympathy. Sympathy means, okay, you're having an issue. I hope you recover soon. But empathy is actually feeling, how can we help this person? And how can we make their life better, even if it is 1% of our effort? So yeah, empathy is one of the most important things of an emotionally intelligent human being, which unfortunately we miss out, especially in South Asian countries where there is so much struggle we are still developing, and so it's probably not the primary need we need to express. So how to handle mental health crisis? Throughout the process, we need to just keep empathy in mind and then make that the base, and then we strategize. So I'll be talking about the RAPID model, which is given by the Johns Hopkins University. There are a lot of other models, but I think this one is quite concise and effective in my opinion. So R, RAPID, R, reflective listening, A, assessment of needs, E, prioritization of needs, I is intervention, and D is disposition. Very easy words, but we talk elaborately. So reflective listening basically means paying attention. Let me just check the time. Okay. Reflective listening, paying attention, full attention, maintaining eye contact. Like I don't know who I'm talking to, but I'm maintaining eye contact to the camera and focusing on what they are saying without distractions. Completely focused. Reflective listening means we are not going to go in conversation. We are listening. Generally, how we are conversating is this person is talking about themselves and that person is talking about themselves. The two person talking about themselves. That's the flawed conversation, but generally practiced. But reflective listening is different. If you see a friend who is coming to you and telling you, I've been feeling there is no meaning left in life and I don't feel like living anymore. You listen, you maintain eye contact, and you change your body language, and you focus what they are saying absolutely without distractions. You give them 100% undivided attention. So attention, and then paraphrasing. You're listening, but how do we make this person feel reassured that you have understood the same thing that they were saying? Reflecting feelings. You're also reflecting their, not just what their feelings. Probably they're not expressing something. Probably this girl who's come to you, your friend, who says there is no meaning left in living after having a, let's say, senior bully experience, and she might be feeling a lot of fear. So you acknowledge that fear and you reflect on that feeling that okay, she's feeling fear. Now what do we do about it? Summarizing the key points that the other person has said to make sure that you have understood their perspective. So the person I've given an example. the person in panic will say, I feel like I can't breathe, my heart is racing, and I'm sweating. I don't know what's happening to me. And you will say, it sounds like you're feeling really overwhelmed right now. You're having trouble breathing, your heart is racing, and you are sweating. And that must be really scary for you. So, your friend came to you with, I can't breathe, my heart is racing, I'm sweating. But you read the micro behavior and you said, you look like, you're really overwhelmed and you're having trouble in breathing, and that must be scary for you. So you are acknowledging, you're concising, there is attention, there is paraphrasing, there is a reflection of feelings, and then you are also summarizing what the other has to say. So in the rapid model, in panic attacks, in anxiety attacks, something happened. In panic attack, mostly people are not even able to tell, but we have to, if they're able to tell them, we have to use the reflective listening. Okay. Now, after the reflective listening, there is assessment of needs. Now, this is important when people are having physical symptoms or suicidal ideation. So, a person, it never happens in anyone's life. If your friend, your family, anyone or mine goes through a sexual abuse and we find them in such a situation, assessment of needs will tell that we really need to take them to the medical help, and probably before registering a FIR, we also need to pacify them emotionally and build trust and be around them. So, assessment of needs will cover all those things, and not assessment of needs basically tells you that you don't need to go by strategy. You have to first assess and then be intelligent enough to take important steps on the basis of that. So ensuring safety, providing basic physical needs, addressing emotional needs, providing practical assistance. Some people will be okay. You might think, okay, this person is gone under disaster. She is definitely emotionally, she or he is definitely emotionally troubled, but emotionally, we need to have emotional assistance, but we also need to provide shelter and food and safety to this person. So, in the prioritizing, we need to do that. So yeah, that's what I was saying. So we talk about prioritization of needs, urgent needs, identifying urgent needs, identifying the most pressing physical and emotional needs of the individual, such as immediate medical attention or assistance with basic necessities like food and shelter. Ranking needs by importance, prioritizing the individual needs based on their level of importance. And the most urgent needs take precedence over that those are less urgent. Addressing needs in a logical order. Addressing the individual needs in a logical order based on their level of importance, and the most urgent needs being addressed first. Okay, now this comes the step I, intervention. Providing emotional support, offering a listening ear, expressing empathy, validating the individual feelings. I think, can we take a break? I think it's too long, right? What do you say? Because I think there's a lot of content here. Can we take 2-3 minutes break? I'm just speaking and speaking.
Yes, ma'am, sure.
Yes, ma'am.
Yeah. Is it okay for everyone else? I hope people are not zoning out.
Yes, ma'am.
Okay, we'll take, let's take, it's 11:38. Let's start by 11:43. Take 5-minute break. Drink water, whatever you want.
Okay, ma'am.
Okay.
क्या कर रही है बेटा? कॉलेज जा रही है? चलो सच में गया लेकिन ना एक पौने खान जाम
अच्छा
अभी काम चलेगी
छुट्टी नहीं मिल में ज्ञान
हैं
दोबारा छुट्टी नहीं मिल में ज्ञान
पहले बाना हो जान छा ना
अब छुट्टी छुट्टी सी
यार छुट्टी नहीं की
जय कौन है
ध्यान
की जान
अब क्या बोलो ना अब तो लोग बोल रहे भैया इनसे किराया दे दो पर आ जा
राम 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 घूमना
दादा बहुत होता है दिखाओ तो
बड़े यार दादा बहुत होता मेरी
3-4 दिनों का रोटा खाता हो
उससे क्या होगा
तो खैर कुछ नहीं था
क्या तो फिर अपन
अच्छा तो तुम रामनगर पढ़ो
ना यार चिल्ला कुछ सामान लेना है जाम
अच्छा
परवार ट्रेन टिकट पे आ रही
तुम्हारे को फ्री कर रखा
दान में रात जाने एक दिन
तो भी चले जा
तो जाना मतलब 20 साल का बाद 20 साल का बाद जाना मतलब
जब पे बचो हो जाए
तो जाना मतलब ये मैंने लास्ट
इनका तो पेपर चाहिए
ये एक ही रन
आज से भी नहीं जा पाएगा हमें कभी छुट्टी नहीं मिलेगी बाहर फिर नहीं झूला जाकर सीधा
छोटू जाएगा साथ में गाँव में
गंगा का हरा भंडार आएगा
गंगा ये हमारा मत
30
जून ना तो तुम्हें नहीं हो रखा
30 मई
30 मई जून यही
एक महीना है तो सरकार को बता मैं यार
30 मई
हाँ
आज मैं तो जाना चाहता हूँ मेरा घूमा था
हाँ
कल जा रही क्या
अच्छा मैं गाँव गया
मंदिर मंदिर गए
अच्छा
वो जा रही फरीदाबाद छुट्टी वाला है सब
फरीदाबाद का बढ़िया में प्रभात वेले स्कूल का
है
प्रभात वेले स्कूल का है
बने छुट्टी नहीं होगा
सैनिक छुट्टी है ना सैनिक छुट्टी से
हमारा तो आ रहा है थोड़ा सा ही आएगा वो इनकी खाली होगी
Hello, everyone. Before we start, actually, I wanted to give you a little bit of hands-on exercise experience, which probably you will be going to use with people who will require emotional first aid. So, if you guys are ready, let me know.
Yes, ma'am.
Everyone is ready? Can they just show by the raise of a hand?
करो नहीं बोले
12, 13, 17, 18, okay. We need some more hands. Some more to go. Let's wait for a minute. I think everyone is okay, more or less. Yeah. So this is called 5, 4, 3, 2, 1 rounding technique. So wherever you are, just sit comfortably and take a long deep breath. in, hold, and breathe out. And now we'll focus on 5 things. 5 things that you can see around. Just see 5 things. Another deep breath in, hold, and breathe out. Now we'll focus on 4 things you can touch. Touch your hair, you can touch your hands. If you're wearing glasses, you can touch that. And touch your clothes. You can touch the laptop, maybe the seat cover you're sitting on. When you have done it, take another deep breath in, and breathe out. Now we raise awareness to 3 things we can hear. So you can definitely hear my voice. And there must be sound around you, your fan or AC. Or you can, if you can't hear more than 2 things, you can imagine a sound. You can imagine a song. And whenever you're done with it, take another deep breath in. You hold till you can, and breathe out all the stress. Now we move to 2. Just remember 2 things you can smell, or maybe you can smell your conditioner, shampoo, or the lotion in your hand. You can smell nice lotion of my hand. Take another deep breath in. And hold. And breathe out. The last thing to recognize is the taste. So we can just go back to our own mouth. And what was the last thing we ate? Just recognize the taste. Take another deep breath in. Hold. And breathe out. So this is called 5, 4, 3, 2, 1 grounding technique, and you can Google it. It's very effective. The reason we did it is because probably you might have gone tired on the webinar, and this technique brings you back to your body and senses, and it's good for the concentration. Also helps in all the panic attacks and processes. And I'll resume and just share. Just let me know, Priyanka, if you can see this. You can see this, right?
Yes, ma'am.
Okay, I'll just do a little bit of revision of the rapid model because it was too much of details. However, it's very simple. Reflective listening, assessment of needs, prioritization of needs, intervention and disposition. If we go into details, we'll bore out each other, but to talk in details. But it's very simple, and you will be able to do it. So reflective listening is, maintaining eye contact and acknowledging the other person's feelings and emotions, and also summarizing them and giving it back to the person by paraphrasing what they were saying. assessment of needs is what are their needs,
मोदी या साथ
what are the physical needs, what are the safety needs, what are the emotional and practical
बना के
assistance.
छोड़ेंगे दिल्ली
So
से
what are the needs? Just
तो तुम देखना
list down the needs,
पूरा बुलडोजर पर
and then prioritization. So out of all those needs, what's the important need?
बिल्डिंग को
What's
बुलडोजर
the urgent need? And what's the more logical need? Is it moving fine, right?
चला देगा वो उसने कह दिया तो चला देगा वो
Yes, ma'am.
Okay. Now we were talking
वो
about
क्या हुआ है
intervention.
45 चीज ने खराब करे ना
So providing emotional support is one of the intervention that we will be giving to the person who is having panic attack, anxiety attack, suicidal ideation, or a victim of
क्या
circumstances.
करना चाहिए अब
Offering a listening ear, expressing empathy, and validating individuals' feeling. So expressing empathy. How do we do that? If somebody, let's say,
लड़की को
your friend comes to you and gone through a breakup, or that's generally the concern among your age mind who's got such experiences, and it comes to you. So males generally will say, but women will also will talk about it, will engage in conversation, analyze, and go into the details. But at the same time, don't forget that the person is suffering. Express empathy and actually take care of their needs. So that's one of the way to express empathy is by putting yourself in the shoes of the sufferer and see what might they be requiring. Try to extend support. Promoting a sense of safety. So it was a huge case when I was working in my last office. I was dealing with sexual offences cases where small children were abused. So definitely emotional support comes later than ensuring them safety, comfort, food, and a place of safety also. And encouraging problem solving. This is important. What we generally do in our lives, you might have noticed, all of us, that if somebody comes with a problem, we make it bigger. We talk about it, make it like a mountain, and then we're just sitting beneath the mountain, can't help. So focus always on the problem solving. Somebody is coming to the problem, let them express, let them vent out, let them say what they want, but strategize and encourage that okay, this happened. This issue happened with the teacher, and you feel very humiliated about it. You feel very stressed out about it. But what can we do? And supporting connections with others. So after the traumatic event has happened, it is important. People might even let's not forget about the traumatic event, because it's generally not the case in our situations. But if somebody's broken up with a friend or a partner, the friendship breakups is also a big thing in your age group, or a partner, or has had a lot of crisis with the family members. There are issues with the let's say somebody gets a back poor marks which they were not expecting, or any of those things. They might feel like they're not having enough social support. So connecting them with people who might be able to basically, it can be your own family and friends, or it can be just a peer support group of people who have suffered from the same issue also, to cope. Now disposition, assessing the individual ongoing need, assessing ongoing need and determining if they require additional supports and resources beyond what has already been provided, determining the appropriate level of care, just assessing that the care is appropriate. If somebody is come to you, you have been in a situation of witnessing somebody having a panic attack, an anxiety attack, you do help them in that moment, but also make sure that they address the issue why it's actually happening, because it's never one time thing. There is some issue there, it needs addressing. There are mental health concerns which need addressing, so they either see a psychiatrist or see a psychologist or anyone who can help them in a prolonged way. And providing referrals and resources. Again, I already said it. If they can't figure out themselves, help them with referrals and researches that will be helpful. If it's a doctor, if it's a, let's say, victim of crime, then filing an FIR, telling them what would be the legal ways to go about it. If you know all these things, then do. I mean, you are also students, so I'm not expecting you or telling you all these things that you'll be able to do all of these things. But if you do just 10%, that's okay also. Yeah, so we'll be talking about now hands-on techniques. What's hands-on technique? So this was the rapid model is more of a strategy, overall strategy to keep in mind. But we need immediate things to be done. So first of all, if panic happens, if anxiety happens, or any emotional social distress happens, keep calm. Only then you can help the other person. If you lose your own shit, I don't think so you're going to help anyone else. So keep calm and come back to that 5-4-3-2 model that we just did, grounding technique. Remain trustworthy. So if somebody is coming to you and telling you things and they are in great distress and probably they could find you trustworthy, so be trustworthy throughout the process, after the process, and forever basically. So trust is key ingredient, which is also provided in therapy. That's why people come to therapy, because there is trust missing outside and they need somebody confidential and trusting. So remain trustworthy. Encouraging active and deep breaths. So, first you have to learn how to take deep breaths. Take deep breaths, hold for a moment, hold as much as you can, exhale slowly. So, if the person is having panic attack or anxiety attack, definitely a deep breathing, breathing in, this thing will not work in people having suicidal ideation, but with panic and anxiety, you can encourage active and deep breathing. And 5-4-3-2-1 grounding technique, which brings you back to the center, brings you back to the concentrating point, to your own self, to your own senses, and let you forget about the past and the future. Drink a lot of water. Give them cold water, ice water splashes, or it really works in those hot flashes. If people are feeling in panic attack, you splash cold ice water, or you just put your face in a bowl full of ice. It helps in like 10 seconds. And be empathetic throughout. So these are the hands-on techniques. And that's all from my side. Thank you everyone for listening. I hope you understood some things. If you don't, if you haven't, you can ask me. You can see anything from the website. Yes, I think that's about it. Priyanka, your video is paused. You want to say something? No. Esas, do you want to say something?
Hi, yes, ma'am. I was just waiting for Priyanka.
She's lost connection. Probably she'll join again.
Firstly, I think on behalf of all the students here, I would like to say that very cute elephants.
I know,
Whenever the
right?
slide changed, I was like, oh, that's so cute. I had a question, ma'am. So, like, if there's a person who is in an overwhelming state of emotion, so like, if a person is breaking down, maybe like crying and like just screaming that something's bad gonna happen, they don't know what to do, how to deal with it. So, in a practical sense, like, what would be the first thing as a passerby or as a stranger you would say to that person?
You wouldn't say to that person, you would listen. So if the person is having a breakdown or saying, offer your presence, offer your full presence, and tell this person that I am there with you, I will support you, and tell me what's going on. Let them speak. So what we need to say is I'm there with you and also mean it, and offer them your presence. Probably not say a lot if if they don't want to hear anything. If they want to hear anything, if they will probably ask in few moments. Yeah, because I think saying is definitely very ineffective. If we are crying, let's say if I was crying in my childhood, I would have really liked people just hear my rant. So I mean, you can go back to your own self. Like, what would you need? Yes.
Thank you, ma'am.
Anyone else?
Ma'am,
Yes.
good afternoon, ma'am. So, first of all, a really amazing session. I honestly enjoyed it a lot. I'm sure everyone did as well. So, I have this one question. Like, basically, in this generation, I would say there's this sort of trend that people try to romanticize their problems, or there's this concept of dark humor where you make fun about about your trauma some as a coping mechanisms. Sometimes people make fun of the way they were abused in their childhood, by be it by their parents or in general, or well, they make fun about killing themselves, right? So this has been generalized so much that even if a person is not suicidal, they will make fun about it. So how do we differentiate when a person is making actually suicidal or they are not?
It's difficult. I mean, I understand you. And sorry, it says Simensha, but what's your name?
Ma'am, Shambhavi.
Shambhavi. Yes, Shambhavi, I don't know. I mean, it's difficult to understand, but I would like to go by just believing the person, but at the same time have my own logical reasoning. And if you think, okay, this person is just having, I don't know why he's making fun of suicidal ideation, you can probably tell them that you probably need to talk to somebody professional and probably consult a psychiatrist if you're feeling it. But you can always not engage with some person who doesn't appear serious. Why would you want to anyways? So, but it's difficult. I mean, let's not get into that, why they are doing this, that. It's gonna take a lot of our energy. And second thing is, people are into dark things and just saying it for no reason. And you said romanticization of suffering. I read a post just now, like before the session, a psychologist wrote on LinkedIn, and it was just exactly the same thing. Like, we have our stories. We have our stories and we keep narrating it. And sometimes we get fixated by those stories, and it becomes like an ego-fulfilling thing. We associate and identify that story, and we identify to an extent that we feel like a loss of identity if we stop talking about that negative story of our life. But then we also need to see that it's a negative association to our identity. So I mean, not everyone got that sort of emotional intelligence, but yeah, you were right. There is a lot of romanticism of suffering also.
Yeah. Thank you
And
so much.
yeah.
Yeah.
Anyone else?
Guys, do we have more questions? Okay. So, ma'am, generally this session was conducted for the purpose of directing the students from psychology towards the
Okay.
further future career aspirations and all
I
that
can
stuff
talk.
as well.
Yeah.
Please give some insights into that direction as well.
Yeah. So I think if you are studying psychology, you are in great time period studying psychology. And when I started 13 years ago, that was my starting of the bachelor's. I had no idea like what would I do. I thought I'll probably go into research and become a professor because I didn't see many psychologists. But now, this is good period to be a psychologist, and it's only onwards and upwards from here. So I will say some things. Priyanka, I think most of them are undergrad, right?
Yes, ma'am. All are from undergrad.
So yeah, so after your undergrad, do your MA, and if you want to go in clinical, you can do MPhil. And I would say, don't if you are studying from decent enough college, then don't go for paid internships. And they do give a lot of hands-on experiences in colleges. So probably do, if you want to increase your skills, probably do a lot of online courses. There are a lot of courses on Coursera, Udemy. Rather than going for paid internships, I think that's a better option. And do a lot of field work when you are in your masters. Do a lot of internship when you are there. Like, get as much exposure in those 2 years. But after those 2 years, maintain your focus on building your own practice. See, so when you do your master, I think it should be 21, 22 years old, very young. And that is a good time to build your own practice. A lot of people will also try to find job, and they think that, there is no impending doom that I was talking about. Feeling of impending doom that most psychologists face, that okay, what we have done, it's a dead end now, we can't make enough money and things like that. So when you are in bachelor's and master's, make your website, start writing blogs, talk on Instagram Live. Your generation is pretty good at that. So make your social media presence, make your Google presence. Basically, if you search my name on Google, you'll see like at least one page full and a half page on the next. And it's because I've written a lot, not written, probably listed myself on a lot of platforms. So make sure you have to be a psychologist 3 years down the line. So make sure when people search you when you start, they will Google you definitely, because that's the trust building factor. You have enough there. So social media, not just Instagram posts, right? Quality content on blogs. Maintain your own blog, make your own website, and talk to other psychologists for guidance. But yeah, avoid paid internships. And there is a huge imposter syndrome among psychologists and all the other healthcare people, even in doctors. I have clients who are doctors in US, in XYZ country. They are having imposter syndrome. So what are we? So just understand that imposter. Okay, you haven't done anything wrong. You have not studied a wrong subject. There is a huge bright future ahead of you. So build connections, build a lot of network, and a genuine network of people. I think that's about it. That's all I want to say. I don't know. Like, people can ask specific questions if they want. How do they do certain things in the future? Yes, Akshita, go on.
Hi, ma'am. Thank you so much for the session. It was very helpful. Ma'am, not towards the academic or industrial line. I had a general question. What should be our ethical consideration while thinking that that person needs our mental first aid, our mental health first aid? What should be the consideration that we take in our mind?
Consideration as in?
That the person should get a mental health first aid. Like, what should be the ethical consideration regarding that?
Do you mean what would be the parameters?
Yes, ma'am.
So we have on the slides. I'll share the slide with you. I don't have any issues sharing the whole slide thing. make use of that. So there are panic attacks and anxiety attacks and suicidal ideation, and they have symptoms written down. So you have to check for those symptoms. If we get wound, if I get wound in my elbow while cycling and I saw the blood coming, so that's the consideration, right? That's the ethical consideration, that's the parameter. But for emotions we don't have that much vocabulary, so that's why we talk about symptoms. If somebody's heart is racing, if somebody is having like shortness of breath, and they're saying clearly, they're sweating and they look like okay, they need some help, and they're probably saying also that I'm feeling this way, that way. So that's the ethical consideration, that's the parameter we need to go by. We need to see and probably read a lot of symptoms and observe, and then that will sharpen our basically response mechanism.
Thank you, ma'am. Ma'am, but if someone is suffering in silence, like there are silent panic attacks too, and
Right.
suppose they're in a classroom, so how do
Yeah.
we go about in that situation?
Okay, so first aid is generally given for emergency situation, Akshita. But if somebody is suffering in silence and you can see it, okay, you can see it from distance, and we are all emotional beings. We understand this. That if somebody is suffering, we can know it. Because of our reason. There is this thing in the brain called mirror neurons, which means that mirror neurons' job is to actually mirror the micro feelings of the environment. So we will always see it. If you talk from the neuroscience perspective, we always observe and understand it also. But in that situation, probably we will not be able to provide first aid, what we have discussed, but you can tell them to seek therapy. You can also, if you have emotional bandwidth, then you can tell them, okay, let me know if I can help you. I would be happy to help you. What's going on? So the idea is to break the ice. How you do it, you would know better in that situation. You try to break that ice, and I have seen it. No matter what, if the person is having a low mood, and we have seen these people, friends in our lives, who have been constantly in low mood. If somebody goes and break that ice, it's like a balloon burst. They just open up. They will tell you stuff. So, and then you can from there on take on. If you feel like, okay, this is something I can handle, help them, it's okay. If you feel like, okay, they might need a therapist help, so you can go find them help according to their finances. So it's the assessment of needs you need to do in that matter, and prioritization of needs. Is this making sense?
Yes, ma'am. Thank you so much.
Ma'am, I had a question.
Yeah.
Ma'am, so like very basic on a student level, like all of us are in college right now, first, second, and third years. So how can we just promote mental health awareness on this level?
So difficult. Yeah, I mean, see, the thing is, it's not a priority as us for us. See, therapy is also expensive. Therapy is also
My name is Yuvanshi. I am from SRCASW, that is the Mental Health Awareness Society.
Oh, what's your name?
Yuvanshi.
Yuvanshi, I'm sorry. It says Ehsas. So I thought your name is Ehsas.
I'm from the society. So like our aim is to spread mental health awareness, but like working in the society for 3 years, I've realized that there's only so much you can do at a college level, because even in college, like you don't get as much recognition as you would if you were a performing society. So
yeah, definitely.
They don't take you very seriously, and it is a cold fact, but it is. So
we'd like to say, Yuvanshi, we are recording this.
Oh yeah.
Yeah. See, I'll tell you something. It's the elephant in the room. The reason I used elephant as a metaphor is because of what you just said. because it's the huge elephant in the room which we don't want to touch, we don't want to address, unless it's sitting on us, like that the elephant was sitting on that car and broke the car. That's when we want to address the elephant. We don't want to address it before. And unfortunately, I don't know why it's so hard for me to even say. But as a psychologist, I also, I don't want to convince my clients to continue therapy, even if I see them, they're still struggling. If they want to terminate, it's fine. It's their choice. But, most people, if they feel a little nicer, they think everything is okay, because we don't want to talk about stress and, probably not want to constructively work on it. And there is a huge human psychology thing, which is staying in the negative situation is much more easier than working towards the positive goals in our lives. Being a positive person, being disciplined, healthy, emotionally, socially, financially, it's difficult. And remaining in the rut, smoking up with the friends every night and day, having all sort of depression, it's so easy. So it's just human psychology. It's how human mind is made. The survival instinct are to just go down the drain. And the evolution is made, the human evolution and the civilization happened because of a lot of efforts. So not everyone will have all that emotional resilience to actually do good about their lives, to raise their awareness, to raise their consciousness, to become a better person, to come out of the issue. So, you do your best and probably not expect a lot of outcome. And have the best intention for people, but still you should be saying, okay, it's there, I have given, I have done it. Now it's there, it's on them, whatever they want. And most people will not come to seek help unless they have hit the lowest of the low of their life. 99% of people in therapy comes to therapy as an emergency response, which therapy is not about. Therapy is not about emergency response at all. Emergency response is admitting to the hospital. But therapy is not that. But most people will come to therapy as a, last resort. Okay, so, with that kind of mindset, it's difficult. And especially in South Asian society, and Himanshi, it's not even people's fault. It's a lot of complication in the society, like family dynamics are very complicated. There is intergenerational trauma, which is very deeply rooted among all the South Asians. So we have always got something else to think. And we have to find a job, internships in your age group, and who cares about mental health? If you are doing okay, you can put that elephant under the rug. So I think it's tough. You do your best, but don't expect a lot.
Very true, ma'am. Thank you.
Oh, that was really helpful, ma'am. Okay, we have one more question from Anna.
Yeah.
Ma'am, I wanted to know that talking about facts, so till what extent is mental health first aid actually used? So do we use it till the patient's immediate psychological needs are catered to, or till their immediate physical wounds are tended to?
See, if you have to talk about emotions and physical wound, then physical wound will precede, because that will probably cause issues in mobility or life-threatening. It can be in certain situations. And if I understood your question rightly, you can strategize, like you can prioritize and strategize who will need what. Like, this is not uniform, this is not universal, which we can cut and paste to every situation. So you can understand, you can read more on that, and you can understand, okay, this person will need panic attack, will probably need to breathe, but a suicidal ideation person probably will need a different sort of, they will be needing a psychiatrist at the moment, or a person to talk to. So you can strategize as per the need. The assessment and the prioritization of needs will help in that situation. Did I understood and answered your question rightly, by the way?
Yes, ma'am. Thank you.
Anyone else?
Okay, so I guess if no one else is there, I'll ask one question from you, ma'am. So generally, ma'am, I believe that in our generation, particularly, we all are talking about this sort of mess, that sort of mess. He didn't talk to me properly, or she didn't behave properly, and depression is a very common word everyone is using. I'm in depression because of my exams. I'm in depression because of my relations, this and that. So. I want to basically know your particular opinion about this whole concept of like people behaving like this, and above that, what do you think about neutralism and diplomacy? I mean, like using neutral behavior and diplomatic behavior with a combination to deal with such sort of situation that, or basically, you could say to deal with life. What would you like to say?
I am trying to comprehend. So I think depression is very loosely used, and so is anxiety, panic, everything else. Can you hear me?
Yes, ma'am.
Yeah. So depression is very, very loosely used, and you're right, but it's a prolonged condition. Okay, and for the diagnosis, we need person to at least have the symptoms constantly for 15 days. So if for 14 days constantly you're feeling low mood, you're feeling loss of appetite or increase of appetite, no physical activity, and sleep issues, and meaninglessness, and these are mota symptoms, but there are more to it, definitely. And you definitely, if the physical symptoms are also dip in the heart rate and breathing is lower, and these things. So that person is termed as depressed in that moment, and that generally requires a course of medications to come over it. Talk therapy is good, but if it's serious, I also refer my clients to psychiatrists 100%. Because if the person has stayed in this situation for 6 months or more, something has gone in the chemicals of the brain. So that will be required by the external chemical to change that neural pathways that have constructed over the time. Yeah, I think you asked a similar question to probably Yuvanshi has asked, but yeah, people are using it, but that's what our discretion is about. If you think you can help this person, and if you think mostly people, whoever is making fun of it, is probably facing something or the other, or using it loosely, is definitely facing something or the other. Probably not depression, but maybe they are very insecure, they're very anxious, they're very fearful, anything else. Probably not just depressed, but we know just 2-3 words, right? We just know 2-3 words. So we say whatever comes to our mouth. So I think it's okay. We don't have to discredit these people who are using it loosely, but we can offer them, if you can. If you can, you should offer them some sort of tips, tricks, or whatever. Tell them, go see this psychologist. There is this website, yourthose.com, which has a lot of psychologists. You can check them out. That will be great. So problem-solving attitude has to be there. Right? We talked in the first aid also that problem-solving attitude has to be there. And if you think the person is just uselessly, want to fit in into the conversation, so saying it, so you can do it. And I don't have any other strategy. You can ignore them. If they're bothering you, ignore them. And about being neutral and diplomatic, I don't know. I was in a bureaucratic setup for 3 years, but I don't think so. It really works, to be honest. We are human beings, and I think we need to have emotions and empathy. At the same time, detachment is important. But I don't know. I'm still trying to figure out. Probably I'll come back to you after a month of thinking.
Yeah, because I thought that neutral behavior and diplomatic behavior towards life is something. It's a form of detachment, so that you could just stay away from all of the toxicity that people are having these days into their lives.
See, you can all. Yeah, it's good. I mean, it's more like a very strong spiritual path, I think. I mean, if that works for you, Priyanka, go ahead. If that makes you happy, do it. But probably it will not make a lot of people happy to be in that situation. So if maybe you are on that level where you can be neutral and diplomatic, and it's good for you, do it. And others will have their own way to handle also. So, this whole concept of individual difference, which is a very important aspect of psychology, comes into the picture. Every individual has their own way of dealing with toxicity, and there is a lot of toxicity these days. I agree. So if you think ignoring them, being neutral, and just it's good. Do
Okay.
it.
Thank you so much, ma'am. It really helped me. Your answer for me.
Yeah.
So guys, if we do have any more questions, kindly post in the chat box or unmute yourself and freely speak up.
We do have one question in the chat box.
Yeah, please. Yeah.
Sometimes when a person is having panic or anxiety attack, the brain kind of goes numb or cloudy. At that moment, what can one do to reduce that?
Yeah. So basically, your brain enters into a survival mode. It's too much that it goes into not doing anything about it. I think we had a slide on it, last little mention on it. And it's not, it's also partly avoidance strategy, but it is also brain survival mechanism. So trust your brain, first of all. It's conserving the energy. You had a lot, I don't know what's the background, but conservation of energy, everyone knows. We have limited energy and we translate that energy from one form to another. So you had limited energy and it got exhausted because of the panic attack and all the background history. It got exhausted and your mind has gone into survival mode. And let it be. In that moment, let it be. If your mind has gone numb, what we can do after a point, gradually coming out of that state, is breathing, active and long breaths, drink water, and do grounding techniques. And grounding technique is not just 5, 4, 3, 2, 1. It is also going on a walk barefoot. That helps on the grass. And if you think you constantly see this, freezing out, zoning out, spacing out, it's very common these days because of the stress and trauma. Because brain doesn't react very positively to stresses and events. It goes into survival mode automatically. Like fear triggers and anxiety triggers all the survival instincts as we had when we were reptiles because of the spinal cord structure. Understand that. It goes into that situation. So to come out of that situation, you can do all sorts of grounding technique, coming to the present. So coming to the present should be the goal. How to come to the present is by breathing, by drinking water, by doing grounding techniques, and probably splashing ice if you think that can help. You have come out of the present. If you think you're okay, just observe how okay you are, and then you can talk to somebody. This happened, and now what to do. And if you know the solution yourself, then you do that. How can we reduce the stigma associated with mental health disorders? See, Kashish, I mean, we can only reduce the stigma in our own minds. I think so. Forget about reducing stigma in the eyes of others. You probably will be disappointed. And then don't cause so much disappointment. Because disappointment is a negative emotion, and then you will need to work around it to come over that. So reduce the stigma. If you are having issues, get help, work on it, become a better person, become more emotionally and socially and physically healthier. If somebody's having issues around you, help them. I think that's the only way. Campaigning helps. I don't know how to an extent. It's okay. I mean, I'm not neglecting this, but I partly do because of I've worked in this field for a long time. It feels like we should first 100% take our full responsibility. and simultaneously work as much as we can towards the others. Is this making sense? Anyone else? The questions were very good though, very, very intelligent and good questions. Most of them I don't know how to answer, but I tried.
Do we have any more questions? We are just about to wrap up the session.
Yes, Kashish. I think at the level of student, you can reduce the stigma by writing about it. Also, on social media, being honest about your own mental health, because on social media everyone is having the best of the life and also only showing the best of the side. So making social media real can one of the ways to reduce stigma and live your authenticity on social media can also be the strategy. As students, as youngsters, I think that can be the strategy. Like if you are having regular meal or just not so good cutlery in your lunch, probably show that whatever if you're having a low day, you can talk about that rather than just holidays and things like that. Make social media real can reduce the stigma around mental health. How can we help students who mental health problems? You cannot.
Sorry, ma'am. Just sorry to interrupt. I would like to just read this question for all of us because it might be a common question. So Kashish has asked a question: How can we help someone who is going through a mental health problem and they don't want to listen to our advice? Over to you, ma'am. Sorry.
Just a second. I'm getting a call. I'll just take this call and.
Okay, ma'am.
Yeah, I'll mute this. Yeah. So, see if somebody is going through a mental health problem, and there are a lot of forms of mental health problems, and the major ones that you will see is depression, stress, anxiety, suicidal ideation. You will also see a lot of bipolar disorder these days. Bipolar disorder is not a personality disorder, it's a mood disorder, which means bipolar person means somebody who is having intense low mood phases and intense high mood phases, sometimes more low mood phases and lesser high mood phases, and more there is a combination to it, but mostly bipolar has more low mood phases. And there is BPD, borderline personality disorder, also borderline personality disorder. You can read up, it's very elaborate. But when you read, make sure that you're not associating yourself with the symptoms and not Googling symptoms. So, and ADHD is very common, also very, very common these days. People with difficulty in having attention, zoning out very, very quickly. These are the major symptoms of ADHD, fidgety behavior. So I felt I was ADHD in my life, so don't Google again like me. So, you can address mental health problem of your loved one. You can provide your support, but don't endlessly keep providing if they are not reciprocating. Because what will happen if you keep endlessly providing, it means your boundaries are enmeshed and you are basically emptying your tank of empathy. So when we give out, we balance it by having it being ourselves in an equal relationship, be it friendship, romantic relationship, teacher relationship, or parents or anything. It has to be on the equal level. If you think this person is not wanting to listen to your advice, you offer them advice, but you also let them think on their own. Try not to be forceful about it. Try not to pressurize, even though they will say, "I don't need your help." और गायन saying ऐसा कुछ नहीं है, मुझे कुछ बीमारी नहीं है, मतलब this is what people say. So you tell them and you let them come to you. Tell them few times and let them come to you on their own. Now they know the answer, they know you know the answer, you know how to help them. It's on them right now, it's their discretion. But yes, when somebody is having suicidal ideation, we need to step up a little bit more. We can't say, okay, now they don't want to do suicide. You probably might need a hospital assistance in helping them. Other than that, it's okay. You can let them on their own. But if you think the person is suicidal, we need to reduce the risk factors in the environment. We need to remove all the sharp objects, all the, we have rassi or anything which they can use. So, and probably get their immediate caregivers involved who can take them to the psychiatrist or the hospital admission. Yeah, this is what all you can do.
I hope Precious has got her answer. Thank you for answering all of the questions, ma'am. We'll not be taking much more questions. We'll be sharing your LinkedIn profile to the students. If they want to ask any more questions, they can just, I guess, proceed with messaging you. Okay. So now, ma'am, will be heading towards the vote of thanks. On behalf of IIC, SRCASW, and the Scientia, I would like to express our sincere appreciation to our speaker for taking the time to be with us today. We are grateful for the opportunity to learn from her and benefit from the wealth of knowledge and experience. We extend our deepest gratitude to our principal, ma'am, Dr. Payal Mego, for being a constant pillar of support and strength. We would like to extend our heartiest thanks to all of the teachers who were present during the meet for their constant support and motivation. Last but not the least, we would like to thank our lovely audience for showing their interest in this session and making this session much more interactive and interesting. Once again, thank you all for joining in. Thank you so much, ma'am.
Thank you. It was very nice talking to you all and very interesting questions. Good luck to everyone. So many things we are doing. Okay, I'll sign off now.
Thank you so much, ma'am. It was lovely to